Metformin is one of the most commonly prescribed medications for type 2 diabetes, but there are many aspects of this drug that patients may not fully understand. Understanding the truth about metformin is crucial for every diabetic considering or currently using this medication. In this video, we'll explore key points about metformin that every diabetic should be aware of, providing a clearer picture of how it works, its benefits, and what to watch out for. Metformin is unique among diabetes medications in its approach to managing blood sugar levels. Primarily, it works by targeting the liver, a key organ in glucose production. Normally, the liver releases glucose into the bloodstream as part of its regular metabolic function, but this process can be excessive in people with type 2 diabetes, contributing to higher blood sugar levels. Metformin acts by suppressing this glucose production, thereby directly addressing one of the primary sources of high blood sugar in diabetic patients. Furthermore, metformin enhances the body's sensitivity to insulin. Insulin is the hormone responsible for signaling cells to absorb glucose from the bloodstream and use it for energy. In type 2 diabetes, cells often become less responsive to insulin, a condition known as insulin resistance, which results in higher blood sugar levels as glucose accumulates in the bloodstream rather than being absorbed by the cells. By improving insulin sensitivity, metformin helps the body respond more effectively to its own insulin, facilitating better glucose uptake and further contributing to lower blood sugar levels. This dual action of metformin, reducing glucose production in the liver and improving insulin sensitivity, makes it a highly effective and widely prescribed treatment for managing type 2 diabetes. Its ability to target these fundamental aspects of glucose regulation without relying on additional insulin production, a common mechanism in many other diabetes drugs, sets it apart in diabetes care. Now, let's delve into its long-term benefits beyond immediate blood sugar management. Metformin isn't just about the day-to-day control of glucose levels. It also plays a significant role in reducing the risk of several serious health conditions, making it a valuable tool in the broader management of type 2 diabetes. One of the most critical benefits of metformin is its potential to lower the risk of diabetes-related complications, particularly cardiovascular diseases such as heart disease and stroke. These conditions are common complications for those with diabetes because high blood sugar over time can damage blood vessels and the nerves that control the heart. Research has shown that metformin can improve cardiovascular health, partly due to its effects on improving lipid profiles and enhancing insulin sensitivity, which help reduce the overall stress on the cardiovascular system. Moreover, intriguing evidence from various studies suggests that metformin may also play a role in cancer prevention. Some epidemiological studies have found lower rates of certain types of cancer in populations taking metformin, suggesting its influence extends beyond glucose control into broader disease prevention. While the exact mechanisms by which metformin could reduce cancer risk are still under investigation, researchers hypothesize that its influence on lowering insulin and glucose levels, both of which are factors in cancer cell growth, may play a part. These long-term benefits underscore the importance of metformin, not just as a treatment for immediate blood sugar regulation, but as a preventive measure against some of the most severe complications of diabetes. This dual capability of managing both acute symptoms and reducing long-term risks makes metformin a cornerstone drug in diabetes care, offering hope for both improved daily management and better overall health outcomes in the long run. As we continue to explore the benefits of metformin, it's worth noting its unique impact on body weight compared to other diabetes medications, which often contribute to weight gain. Metformin stands out by potentially aiding in weight loss, an effect that, while typically modest, can be significantly advantageous for those managing both diabetes and weight concerns. Metformin's weight loss effects are not fully understood, but several theories have been proposed to explain how it might help reduce weight. One leading theory is that metformin enhances the efficiency of how the body uses insulin, leading to improved metabolic function and lower blood sugar levels, which can reduce hunger and decrease calorie intake. Another possible mechanism is that metformin may influence the gut microbiota, leading to changes in metabolism and energy storage. Additionally, metformin has been shown to decrease the absorption of glucose from the digestive tract and increase the use of glucose in the tissues, both of which can contribute to weight loss. This weight loss effect is particularly beneficial for individuals with type 2 diabetes, as excess weight can exacerbate many complications associated with the condition, including increased cardiovascular risks and more severe insulin resistance. By helping to control weight, metformin not only addresses the core issue of blood sugar control, but also aids in the overall management of diabetes. While the weight loss associated with metformin is generally slight, it can be a welcome benefit for those struggling to manage their weight through diet and exercise alone. It's important to note, however, that metformin should not be used as a primary weight loss drug. Its use should be part of a broader diabetes management plan that includes healthy eating and physical activity. Now, continuing our detailed look at metformin, it's essential to consider the side effects associated with this medication, despite its numerous benefits. While metformin is widely recognized for its efficacy and safety, like all medications, it can cause side effects, particularly gastrointestinal issues, which are among the most commonly reported. The gastrointestinal side effects from metformin can include nausea, diarrhea, and gas. These symptoms are most prevalent when beginning treatment as the body adjusts to the medication. The reason for these digestive issues is not fully understood, but metformin's action on the liver and intestines, which alters glucose production and absorption, may play a role. To manage and minimize these side effects, most healthcare providers often recommend starting with a low dose of metformin and gradually increasing the dosage. This approach allows the body to adapt to the drug slowly, reducing the intensity of gastrointestinal reactions. Additionally, taking metformin with meals can help lessen stomach upset. Another effective strategy is opting for the extended release version of metformin, ER. The ER formulation releases the drug slowly in the gastrointestinal tract, which not only helps reduce the immediate impact on the stomach, but also extends the drug's action, potentially enhancing overall glucose management with a lower risk of side effects. Remember that it is highly important to consult your healthcare provider if you experience persistent side effects, as there are usually options to adjust the treatment to make it more tolerable. Moreover, these side effects often decrease over time as the body becomes more accustomed to the medication. Rounding out our discussion on metformin is an important consideration regarding its long-term use: the potential for vitamin B12 deficiency. Metformin is highly effective in managing type 2 diabetes, but its impact on vitamin B12 absorption can lead to deficiencies if not properly monitored. Vitamin B12 is crucial for nerve function, red blood cell production, and DNA synthesis. It is absorbed in the small intestine, but metformin has been shown to interfere with this process. The exact mechanism isn't completely understood, but it's believed that metformin affects the intestine's ability to produce and absorb the intrinsic factor, a protein essential for B12 absorption. The risk of developing a B12 deficiency increases with the duration of metformin use and the total cumulative dose. Symptoms of B12 deficiency include fatigue, weakness, memory loss, and neurological changes, which can be particularly problematic for individuals with diabetes, as they may compound the complications associated with the disease. To mitigate this risk, it's advisable for patients on long-term metformin therapy to have their vitamin B12 levels monitored regularly. Simple blood tests can detect B12 levels, and if a deficiency is found, it can typically be easily corrected with dietary adjustments or supplementation. Vitamin B12 supplements are available in oral form, or in more severe cases, as injections that are highly effective in restoring normal B12 levels. Discussing B12 supplementation with your healthcare provider is essential, as they can provide personalized advice based on your unique health situation and specific needs. This preventive measure ensures that the benefits of metformin in managing diabetes are not overshadowed by the avoidable consequences of vitamin B12 deficiency. As we delve further into the nuances of metformin use, it's important to acknowledge that despite its status as a first-line treatment for type 2 diabetes, metformin is not suitable for everyone. Understanding its limitations is crucial for ensuring your safety and the effectiveness of your diabetes management strategies. Metformin's primary contraindication is its use in those with severe kidney dysfunction. The kidneys play a vital role in clearing metformin from the body, and when kidney function is impaired, metformin can accumulate, significantly increasing the risk of lactic acidosis. Lactic acidosis is a rare but serious condition characterized by the buildup of lactic acid in the blood, which can lead to symptoms such as muscle pain, fatigue, respiratory distress, and in severe cases, can be fatal. Due to this risk, it's essential for patients to have their kidney function tested before starting metformin and periodically thereafter to ensure that the kidneys are able to handle the medication. The guidelines typically recommend assessing kidney function at least annually or more frequently in patients with an increased risk of developing renal impairment. Additionally, there are other groups for whom metformin may not be recommended. For instance, individuals with significant liver disease, alcohol dependency, or certain severe infections might also be advised to avoid metformin due to the increased risks of adverse effects under these conditions. For patients who are unable to use metformin due to these risks, alternative diabetes medications are available that do not carry the same risks associated with kidney function or lactic acidosis. These alternatives can be discussed with your healthcare provider to tailor a safe and effective diabetes management plan. Metformin is not a one-size-fits-all solution. Careful consideration helps maximize the benefits of diabetes treatment while minimizing potential adverse effects. And there you have it, our video on the truth about metformin every diabetic should know. Don't forget to like, share, and subscribe for more insightful content like this. Hit the notification bell to stay updated on all our latest videos. Have you had any experiences with metformin? We'd love to hear how it has impacted your journey with diabetes. Please share your stories in the comments below. Your insights could be incredibly valuable to others navigating similar paths. Thanks for watching, and let's continue supporting each other in our pursuit of better health. Have a healthy and joyful day ahead.